Hey everyone, it's Michael here at Home Health Success Academy and 10x Patient Referrals. In this video, what we're going to be talking about is how to pay your marketers. Now, this question right here is probably one of the top questions that we get. I will even say top 3 of the questions that we get when we are out there consulting for a lot of our clients or we're out there doing presentations in the field. And it is a good question, and we definitely want to be able to address certain things regarding this and how to be able to determine what type of pay structure should your company do for your marketers, okay? So before we get started, like I said, my name is Michael with HomeHealthSuccessAcademy.com and 10xPatientReferrals.com. We help agencies, marketers, administrators, and owners of businesses increase their patients, increase their census, and getting more referral sources, which in turn increases the bottom line, which is the profit of your organization. So I've been in this industry for a long time. I've been helping agencies, and I definitely want to be able to answer this particular question of how to be able to pay marketers in the home health industry. Now, this presentation is for home health agencies and home care agencies, and it's also for hospice agencies as well. And typically, the people that this video is for owners, administrators, director of nurses, or managers of these agencies. But at the same time, this could also help you as a marketer kind of figure out what your worth really is in an organization. So the goal of this presentation is to talk about the current state of marketers and how to create a pay structure for the different types of marketers that we're going to be able to bring into our community. We have to talk about the problems of agencies first, right? What are the problems that are faced by most home care companies, most home health agencies regarding hiring marketers? And just to let you guys know, a lot of agency owners out there are not even wanting to hire marketers because unfortunately they dealt with a lot of real bad marketers out there. And because of that, they're kind of thinking twice before they even jump the gun. But here's the thing, you guys have to understand that your marketing strategy, whether you hire a marketer or you decide to market your company, your marketing is 100% of your profit of your organization. So whatever the results are right now for your census, your profits, it is, parallel towards your marketing structure. So if you want to honestly go out there, you need to and you want to be able to make money for your agency, or you want your agency to have profit, you have to bring in clients. And the only way to do that is really through marketing. And if you want to expand yourself right now, you really have to bring in more people to help market your company. And if you think that just because you have an agency, you're in Google Your Business, you can be searched through your website, you have a business card and a brochure, that for some reason people are going to start coming to you. It's not like that anymore. So one thing we want to talk about in this industry are what we call the fly-by-night marketers. These are those, I want to try the marketing in home health, and they come into this industry thinking that if they sold cars before or they sold software before, that they can actually just jump into home health and start marketing and create success. We've even seen people who have been in the healthcare sector who are marketers for physicians' offices or laboratories, or even pharmacy marketers, so they can just jump in here. They think they can just jump into the home health industry, and all of a sudden it's going to work. And you have to understand that it takes a different type of marketing skill. And to be able to be good at it is you need to be able to constantly train yourself and be aware of what you are going to be facing in the field. And so we have what we call fake marketers. And we see a lot of these people also in this industry. And like I said, these are the problems that a lot of agencies are facing, is that people are coming in thinking they can be great marketers, or then we have the fake marketers, the one who try to fake it till they make it sometimes. But here's the thing, most agencies will not want to keep you on board if you cannot produce. Now, if you're an agency and you think that a marketer is going to jump into your company and start bringing in clients right away, that's also a misconception, and you should not think of it that way. Just because they have experience in the field, they have experience marketing for another agency, that all of a sudden they jump to your agency and they're going to all of a sudden bring in patients. It's not going to work that way always. Then we have our independent marketers. These are, I will say, the best way I would want to say something about independent marketers is the fact that they suck the life out of agencies. And these are the marketers that for some reason has connections with physicians already, or they have what we say a rotating amount of patients within their realm that they for some reason take from agency to agency. So these are the marketers sometimes will walk into an agency and say, hey, you know what, I can bring you some referrals, but this is how it goes. I want to be the only connection with these patients. I want to be the only person who has connection with the referral sources. And this can cause a lot of problems for agencies. Number one is the independent marketers are not your employee. And so one thing is we really don't know what they're doing in the field. And also, number two is these are the marketers that will definitely, once you cannot readmit a particular patient, if you're a home health skilled nursing agency, then they're going to bring that patient to another agency. So I want you guys to think about it. These are the marketers that for some reason are, well, let's just say it, they're breaking the law. Okay, and they are bringing you down with them because, you know, for you guys who have a home health agency that's skilled nursing, you're billing Medicare and insurances. What happens is if this patient, if you did not do a proper HIQH or a check on this patient, and they were in a previous agency, and then all of a sudden they bring it to you and you admit them, you're putting yourself in a very bad predicament. Okay, and also for the non-medical home care agencies, you don't want to deal with independent marketers as well, because if they get a better offer from another agency, they're going to bring those clients to that other agency, right? And so you still want to have a person that you hire, that you have on board for your company, because you can still regulate certain things. But just to let you guys know, even employed marketers can cause problems for you as well. And that's where monitoring and management is such an important thing. Now, if we talk about inexperienced marketers, I actually prefer to bring in an inexperienced marketer. If they have a background in sales or anything, or they've done customer service, if you bring in an inexperienced marketer, you have the ability to train them from scratch. Now, the problem with this is if your company does not have a training program set forth, if you don't have a policy and procedure or manual on how to be able to market your company, that can cause a lot of problems for you. Because you can't just bring in an inexperienced marketer and say, this is what you need to do. These are the basics. Go out there and sell. It's not going to work. We also see this with a lot of agencies that for some reason will bring in a nurse and say, okay, great. You have nursing skills. You have the knowledge of nursing. You know what needs to happen to provide care for the patient. I just need you to tell that to the referral source so they want to start using us. And that's going to cause problems as well. So we're bringing in nurses who are nurses, and they're not trained salespeople. Now look, the word sales, the word marketer sometimes is frowned upon in our industry. But what are we doing really? Are we liaisons? Are we, those nursing or medical liaisons for clients? No, we're selling a product. We're selling a service. We're selling our skilled nursing. We're selling companion care. We're selling homemaker, services. That's what we're selling. So we are in sales. Whatever anybody says, we are in sales. And we have to understand the fact that to be good at sales, you must have a good training process. To be good at sales, you must have accountability. To be good at sales, you must be willing to accept the no and learn that it's not really your fault yet at that moment. But if you can understand and you can train your staff on how to present properly, how to sell your services, how to, more target the benefits than the features of your services, that's what's going to help you guys stand out. So with all of these, they're all perfectly fine in this industry. Okay, so fly-by-night marketers, are they fine? Should you have those? Yes and no. Okay, that's the answer for that. Yes and no. But if they are coming to you and you start noticing that they're not the fit for your company, The reason why I said it's okay to have them is because you need to send them off and let them go. Fake marketers, you won't find that out until you hire them. That's the truth. That's why it causes so much pain. Now, guess what? For the fake marketers, it's okay to bring them in, but you have to understand is you need to assess certain things. How do you know that they're fake marketers? Put them in a situation. Give them a scenario. See how they respond. If they can't respond properly on how you would expect them to do in the field, then you know that they are fake. You want to know how to find out if they're fake as well? Call their previous employer. Now, don't just ask the employer and say, hey, did this person work for you? Ask them for feedback. Ask them and tell me, why is this person not working with you anymore since they have experience in marketing? More likely that person did such a bad job in the previous agency that they will tell you everything and they'll give you the do's and don'ts with that particular person, right? So should you hire them? Sure, go ahead and hire these people. But the truth is you shouldn't, okay? You should just to experience the thing, but you really shouldn't, and you should actually figure out right away. Don't just believe anybody telling you, well, you know what, I have experience in the field, I have done this for a long, long time, and then all of a sudden, 3 months later, they're not producing. And that is the biggest problem, is that I truly believe in one thing: hire fast, fire faster. Hire fast, fire faster, okay? So I want you guys to be able to make sure you think about that. And then we have inexperienced marketers, and lastly is you don't provide any training. That is the biggest problem with agencies, is not having a training program for marketing. You guys will have an orientation for your nurses, for your caregivers, for your therapists, and you provide them that training, the one-on-one setup to be able to how to admit a patient, how to be able to do your initial visit, how to do your visit again, your revisit or your readmissions, and so forth. You guys provide so much training. And so we also provide training just for caregivers, for the home health aides, for the homemakers, the companions. Yet we don't, for some reason, have a training available for marketers. The most important position in your company, because the marketers are what makes money for your company, yet you don't have a single training program for that. Now, just to let you guys know, when I first started in this industry, it was the same exact thing. There was nobody out there training or providing training services. They told you, build reputation. It's about people won't refer to you unless they like you, they trust you, they know you. I understand all that. Those are the basics of everything. But how do you get them to know you, to like you, to trust you? What is the process that you should take? Is there such a process? And so when I got into this industry, I had no idea. I was thrown in this industry not knowing what I did. I had a background in nursing. And so I had the foresight to be able to listen and tell myself, I should learn something. There should be some training. And I looked, there was nothing. So I went outside. I took other training classes and sales classes that allowed me to kind of look into things and analyze things and say, hey, can I use this in this industry? Can I use this and apply it to home health marketing? And then I've gone through the whole pain of things, of experiencing and knowing, nope, this doesn't work. Yes, that works. Or that works a little bit. How do I readjust it? So you must have a training program for your marketers, and it's very much an important thing to do. And the last problem that we have for marketing and for having marketers in agencies is that we're not retaining the good marketers. So the problem is, marketers are business people. The great marketers are business people. They know how much revenue they're bringing in the company. And so for example, with my agencies, I'm open with my marketers and I tell them they know what the potential revenue is. They know what the expenses are so that they can make sense of what I'm paying them is a good rate. Okay. So sometimes we cheapen the payments to these marketers. So that's why we can't retain them. And that is where you need to look at that, because there's going to be agencies out there that sees and meets your marketer who is a great marketer, and they're going to poach them. They're going to say, how much are you getting paid based in the other agency? I get paid this much. And they'll say, I'll match it an extra 10,000. I'll match the rate that they're giving you if you come to me and produce the same amount. And that's why they end up leaving. So we have our fly-by-night marketers, our fake marketers, independent marketers, inexperienced marketers. We don't provide them any training, and we're not retaining the great marketers out there. And so these are the problems that most agencies are facing right now, and it's causing a lot of tension in this industry as well. Now, let's talk about the different pay structures and to know the pros and the cons of each pay structure. Okay, because there's different ways of handling things, and so we'll talk about that right now. So the current practices are, base salary. We're paying a base salary and then giving you commissions, right? Then we have our commission structures, right? So we need to be able to create a commission structure that allows a person to be able to say, hey, you know what? I can make more money with this organization. It's not just a one-time salary like a director of nursing getting paid $80,000 a year. No, marketers, you need to give them incentives to be able to keep them, retain them, and to be able to make sure that they go out there and make more money for your company. Pay-per-client practices, right? Some agencies are offering, let me pay you per client that you refer to me. Meaning they're going to say, I'm not going to give you a base salary. This is commission only, type of a job. And pay per client can cause a lot of problems. So you guys need to really stay away from pay per pay clients, okay? Independent marketers, you guys have to say no to them. I've said that already early on today. So let's look at the base salary, right? What is the typical pay for a home health or a home care marketer? So I pulled this up from Indeed.com to be able to show you guys what they have seen as an average pay structure for marketers in the home care industry. And this is what they said. The average base salary based out of 6,262 salaries that they've seen is $48,455. Okay? $48,455. So if we look at that, let me ask you right now, what is your base salary? What's your base salary right now? What and how much do you think you should pay someone? Okay? And really, I would say this, it just really depends on what is your standard of referrals in a month. How many do you expect them to bring in a month is what you need to be able to figure that out. So you can start off at 45, 48, 50,000, or even start off at 35,000. But you guys have to understand that with that said, you need to be able to, in a way, make sure if you have a great marketer on board, right, that you actually give them a good incentive that's available for them. So I mean, just think about it. If you are paying somebody a base salary of $35,000 a year, pretty much that just shows up to be $2,916, right? So that's per month. Now, the next question that you have to ask yourself is how much, money are you going to give them as expenses for them to be able to market your company? Because that's a whole other issue and a whole other video to talk about. But that's one thing that you have to understand. And if you're paying them a lower base salary, you would also want to figure out, are you going to give them that expense card? Are you going to give them a petty cash for expenses, or do you expect them to be reimbursed for it? I've seen some agencies, they'll say, okay, you spend what you need and I'll reimburse you. That causes problems, okay? Because why would you want them to use their own money for now? Okay, so you guys have to look at that in a different area. But right now we're talking about base salary. And then let's look at incentives, how many patients, and should you hire a nurse as a marketer, right? So typical pay for me as a person who has run home health agencies and home care agencies, your medical and your non-medical, I have different pay structures for these type of personnel. So a marketer for a home health agency, a medical home health agency, I will always start them off at $45,000 a year, okay? And at the same time as before I hire them, I put them through a training first and I'll see if they can actually cut it through and become a great marketer. On the interview process, I don't talk about, what are your experiences? I put them right there and then with questions on how they would face certain things. What if a doctor says this to you? What would you do then? Tell me the last time that you were able to get a person to start referring patients to you and they were a difficult client at first. I would put them through questionings of scenario-based items and put them in scenarios and have them act out certain things. I want to see how they are going to be able to react in front of me for the very first time. When I'm interviewing somebody for the first time, there is, some form of nervousness that they have because they want the job. And so at that very moment, you're going to be able to see what really makes them up to be a good person or a bad marketer. And so the good ones will shine automatically. The ones who do not shine in that initial meeting, if you do it correctly, they should not be hired at all. And if they say, I'm nervous, well, guess what? They're going to be nervous every time they meet somebody new for you when they're trying to market your company. So you don't need somebody who is nervous already. You need somebody who's a go-getter. So typical pay, I start off at $45,000. That is my base pay for any home health marketer. Now for non-medical, my non-medical structure, I always start off as well in a low set. So my non-medical, I start off at $35,000. Now for incentives, that's where it gets a little bit tricky. So for incentives, the way you have to look at it is that what are the patients worth for you? Now, we talked about the medical home health agencies that you shouldn't really be doing pay per patient setup. So you can't say, okay, I'm going to give you $40,000 base salary. You have to bring in 4 clients a month with that base salary. And then for every patient that you bring in, I'm going to give you $1,000. It shouldn't be that way. So because that can put you in a bad situation. What I truly suggest is doing what we call a scaling project. So what I would say, if I'm paying somebody $45,000 a year, so think about that, right? If you're paying $45,000 a year, that really is $3,750 a month. So if you divide that with an average of 2 pay periods a month, that makes the person about $1,875 is what you're paying them per paycheck. So looking at that through my group studies, through my studies of my organizations, I can put around $500 for the cost of acquisition per client. And so what I would look at is if I am paying somebody $3,750 a month, which is the $45,000 range, that means right there and then they should bring a minimum of 7.5 patients, and there's no such thing as 7.5, so let's just round it up to an 8. So for the $45,000, they have to bring in 8 patients. Now listen, I do provide some leeway, because if they were able to pass the gauntlet of the questionings and the interview process, that means I see something positive about them, And so from then on, I would understand within the first month that they won't be able to start gaining referrals. Because I come from the teaching that it takes time for referrals, and it takes about 4 to 5 visits before you start getting and converting people to start using your agency. And so we will give them a month leeway, because the first week that they're with us, we are going to put them in orientation. We are expecting them to take the training programs that we have created for them. And so we'll allow them some leeway. Now, by the second month, we would expect them to have and bring in a minimum of 4 clients. And by the third month, we should be seeing them bringing in those 8. Because by then they should have had enough time to be able to develop the skills. They have the time to be able to develop the relationships with potential referral sources if they're actually visiting them. So that is what we would want to say with the base. Now, let's say they're able to go past the base. Let's talk about incentives, right? So the way we would handle incentives goes in a scale section, right? So the way it works is, listen up. If you brought in your 8 patients for this month, if you bring in 5 more patients, then we're going to give you this incentive. Okay, so the way I would structure the first 5, now listen, if they brought in 4 more, they do not qualify for that bonus. They have to bring in 5. Okay, so what I would do then is I would look at those 5, and remember I told you guys that the way we do our setup is we kind of figured that it costs about $500 for one patient. Okay, that's the cost of acquisition of a patient. By looking at that, we would figure that the first 5, we would put the patient at around maybe $300 worth. So if they're able to bring in 5 patients, within, past their normal quota, they will get a bonus of $1,500. Okay, because I can make sense of that. Now, a lot of you guys are saying, well, I thought it was worth $500, so you should be giving $2,500. No, it's not going to be that way, okay? Because I have to think about, there's potential that she's going to have, or he's going to have, some months where they're not going to make their quota. Plus, also remember, we gave them a month and a half to be able to train themselves, and we lost money there, okay? So we need to be able to, in a way, as a business, recoup some of that as well. Now, what happens is you take them to the next level, right? The next incentive level, which is 6 to 10. Now, if they're able to bring 10 patients, okay, if they're able to bring 10 patients now we can start bringing things up as well. So when that happens, we'll look at it as around $400. And so by then, for example, we can give them a bonus structure of $4,000. At first, it was $1,500. Now it's $4,000. Okay, so as you guys can see here, they have a potential to be able to make more. If they're able to bring in 10 extra than what you give them, which is the 18 patients a month, right? Right there alone, they make their base salary, which is what, the $45,000. And if they average 10 patients, each month that they bring in, all of a sudden their salary now is $85,000 a year. So they have a potential to make 6 figures, but they need to be able to produce that. So that's how we kind of figured it in our sects. Okay, so now if they bring in 15 patients, now it gets really fun, because now if they bring in 15 patients, we can up the ante as well. If they brought in 15 patients, then I'll say, okay, great, I can make sense of making each patient worth $500. Okay, so now if they brought in 15 patients more than the 8 that they should have brought in, what happens is now their bonus structure becomes $7,500 a month. Okay, and so that makes sense for that. Now there's going to be months where, let's say they brought in 12. Well, if they brought in 12, they still only qualify for the 10 patient structure of an incentive, not the 15. Okay, so there is leeway for you to be able to make sense of providing the cost for those, the incentives for those, for these particular marketers. Now, a lot of questions is that should I hire a nurse to become a marketer for my home health agency? Now, look, there's no problem with hiring nurses, but remember, a lot of nurses will require you to give them their base salary. And depending on where you are, RNs will be making somewhere around $60,000 to $65,000. So are you going to want to pay an RN $65,000? My answer to that is it's up to you. I personally choose not to. But one thing good about having an RN is they do have clinical experience, but that does not mean that they will be using that in the field. If you have a marketer and you actually train them and give them all the information that they need so they are aware of the products and services, they should be able to answer all the basic questions. That's why you have a director of nursing for your company, is because they can actually do what? They can actually answer any medical questions, for a discharge planner from a nursing home or a hospital if there is. But it's up to your marketer to be, learning all the different terms that they should know. So should you hire a nurse? Yes and no. And another big problem is nurses are trained to be nurses. Nurses don't go to school to become salespeople. Nurses don't go to school to learn management and running a business. They may take some management classes, but I'll tell you one thing. A lot of nurses who are great at managing are only great at managing because they experience it in the field, not because they learned it and it's in their, it's in their resume of whatever they took in courses in their school. Okay, so should you hire nurses? Yes and no. It all depends, okay? I know a lot of amazing nurses out there who are great at sales, and I know a lot of nurses out there who are great at clinical but will never be a great salesperson. So in the end, it's about, can you provide training for everyone that you hire? Okay? So that's what you need to be able to look into for that. Commission basis, like I said, the per patient, I want you guys to be able to stay away from that. Make sure you pay attention and do the scale process. Now, there's this thing called the point system. Some agencies do this as well. And the way the point system works is they assign certain amount of points for Medicare patients, certain points for Medicaid, certain points for Blue Cross Blue Shield, certain points for non-medical private duty patients. And so that's how they determine. And from then on, they will say if you get this much amount of points, this is going to be your incentive. If you get this much amount of points more, this is going to be your incentive. So whether the scale process or the point system, whichever you guys choose, they both kind of work the same exact way. The scale system is just a lot easier for me to be able to calculate. I can say you brought in 10 patients, okay, you're in the second part of the incentive. Whereas points, you have to calculate, you have to look at the patients that came in, and that just causes a little bit more problems for me, okay? Now, that's the best way to look at into how much you should pay. So like I said, medical home health agencies, that's how I look at it. For the non-medical agencies, my best suggestion for payments for non-medical is, like I said, around $35,000 base. And what we kind of do for the incentives is also for the patients, how many they brought in on a scale process. But I also add an extra thing for my non-medical marketers. I give them actually 25 cents to 50 cents for every hour that we have a client remain with the agency. So let's say, for example, we have a client that we have for 8 hours a day, and for the 8 hours a day, in 1 month time, that's close to 240 hours. So if we give them a 25-cent incentive per hour, what ends up happening is, right there alone, they have an extra $60 a month for that one patient. So as we grow, they get to increase their potential income within the organization. It's only a quarter per hour, but it's a lot for them. So if they're bringing in more patients, they're going to want to keep that. And that's a good way to be able to keep those great home care marketers, is because if they leave the organization, those patients, those incentives, that 25 cents per every hour vanishes. So they would want to stay with you. So like I said, that's a good way to kind of retain a lot of them. And there's some agencies out there, what they're doing now is they're giving them shared revenue. And that's another choice that you guys can do as an agency, is to provide shared revenue with your marketers. But that's where you guys have to kind of work around with that structure. And are you going to give them power, and are you going to give them a percentage of the company? So that's something that you have to deal with your lawyers and with your accountants to figure those things out with you guys. Remember, anything that you guys do in a company, you should always, always, always refer yourself to a lawyer, okay? You guys should have a lawyer in retainer to be able to give you guys advices on what's going to be able to work, especially depending on what state you are and what are the requirements in that, right? So make sure you always have a lawyer and retainer and ask them the questions. And these are questions that we've asked our lawyers ourselves, so that we are actually doing things in the right way and not crossing the boundaries of doing something illegal. Okay, so like I said, per patient, avoid paying per patients. Independent marketers, stay away. I'm repeating all of this because I just want to be able to implant that in your head, that it is important that you stay away from those as well. Now, that right there is my quick, thinking about how to pay for marketers. Number one, I hope you guys got some information from this, and hopefully that you guys can use this on your agency as well. Just let you guys know, our strategic consulting company, homehealthsuccessacademy.com, we work with agencies mainly in how to be able to make more money for your company, and that's strictly in the marketing section of things. We also do a lot of advising for a lot of companies as well. We can either provide you guys training with our 10xpatientreferrals.com website. It's our online learning platform that gives you everything to learn how to market your company. And we have the belief of doing marketing with you and for you. So, having this training, we're doing it with you. We have companies out there that has hired our agency to virtually become the marketing manager for their agencies, where their marketers report to us and we report to the company's owners and administrators, which makes it easier for them. So always understand in 10xpatientreferrals.com, these are the things that you guys are going to be able to have. Now, you can purchase each of the course separately, or you can just pay the membership profile that you have. We have right now 3 packages. They're silver, our gold, and our platinum. The silver package is $79.99 right now at this very moment. If you sign up, you get access to all of these things. It's a month-to-month setup. We don't do contracts. We want to be able to be part of you, and you make the decision if you want to keep us with you every month. And then we also have our mastermind program that happens every quarterly. You can have access to that if you are taking the platinum or the gold memberships. Now, the platinum membership, I truly suggest that's $149, and the reason for that is you can have access to me personally as a coach 1 hour a month. Now, just to let you guys know, I only take in a certain amount of people in these calls, and the reason for that is because my time is valuable and I can only do so much for this. So just let you guys know, if you do the $149 a month, then you'll have access to myself or any one of our coaches to be able to help you guys for 1 hour and ask any questions that you guys have. So make the decision right now. If you guys need any help, give us a call. We definitely want to be able to help you guys. One thing is, thank you so much for watching our videos. I hope you enjoyed this video. Once again, this is Michael with Home Health Success Academy and 10xpatientreferrals.com. Always know that home health marketing is easy when you know what you're doing.